science, thanks to neuroscience, and especially with the ability to scan our brains, we now know, doctors now really understand that depression is actually a brain condition. And what they found is that actually there's some structural changes that happen in the brain, and I can go into the possible different reasons, but the end result is that when someone is diagnosed with clinical depression, a structural change has happened in the brain that results in them not being able to think clearly, not being able to think with any kind of hope for the future. They start to lose hope for the future.
Yes.
And so some of the symptoms.
You talk about all of the research that Dr. Daniel Amen has done with all of the scans of the brain and, you know, just understanding the science behind it. And as you rightly said, it's more than just telling someone to pull their socks off. So, you know, please just tell us a little bit more about the science so we can understand what it is.
Yes. So the things to look for. So as I said, most people think that depression is just feeling sad all the time. That's part of it. But let me just read you the list of symptoms and signs that a doctor, when they're talking to a patient, would ask about, just so that all of us who are in the public understand what depression actually looks like. So other than feeling sad, which can be part of it, but not necessarily, people lose the sense of joy and pleasure that they had in things that they normally enjoyed before. That's a big clue. They lose that pleasure, lose the joy in things that they normally enjoyed. But also they have things like guilt. So feeling guilty that they can't be as active as before, feeling guilty that they are a burden to society, burden to their family, feeling guilty that they don't have the energy, they don't have the motivation. And then they get to a point where they start hating themselves. It's called self-loathing, where they actually are angry with themselves. So with that anger also could come anxiety, worry about the future. Then actual physical things changes. So their appetite can change. They can either find that they lose their appetite or they eat more. It becomes like a comfort eating. Their sleep is disturbed. So they find that they can be losing sleep, or they just want to sleep all the time. It varies from person to person. But as we get to the more serious stages of depression, people start to feel helpless. They start to lose hope. Then they withdraw. They withdraw from friends, family. They isolate themselves. And then suicidal thoughts will start to become the predominant thing. And let me just read you what some people have written, Naomi. So people who have been in depression, who've written about it, or who've come through, describe it like this. They say, it's like a gray cloud or a black cloak that comes over you and obscures all positive thought. You feel like you're being crushed. You're in absolute turmoil, despair. All you want to do is to be left alone. And you would, for that moment, prefer to be dead. So they come to a point where they convince themselves that their loved ones are better off without them. They come to a point where they think that the world is better off without them. And there's a sort of certain end stage with depression where they almost have detached from everything and they start to plan their ends. So they get their bank. So this is not everybody, but certain people, they plan, they sort out their wills and their bank accounts because they want to make sure their loved ones are looked after, and they plan their exit. So it's
signs of depression before. What are the clues at the early stages? And, you know, and what's the difference between circumstantial depressions where it's just, you know, people are sad because their circumstances warrant them feeling sad, or where, as you said, where there's a change in the chemistry of the brain that's actually causing the depression?
Yes. So as a doctor, if I'm talking to somebody, I would ask them, how long have they been feeling down? So we all will feel down from time to time because life is like that. Life is stressful. life brings events to our lives where we lose people, we lose things go wrong in our world, and it's normal. It's absolutely part of life that we have to feel sad, express our sadness. But when that sadness goes on and it's day in, day out for a minimum of, we say usually 2 weeks is the marker.
Oh, 2 weeks.
2 weeks of just feeling down, sad, but also losing energy. So when we're looking at family, friends, people in our world, we'll think, do they seem to have lost energy? Have they lost motivation? Do they seem to be not engaging with people as they used to? In other words, are they isolating themselves? Is the predominant speech that's coming out of their mouth one that's talks about not having hope? They can't see a way out of things. They can't see how anything's going to change. So listen to the language of what's coming out of their mouth. And if it seems to be quite different, if it's really negative, but in a way that also carries with it a sense of sadness, a sense of loss, of joy, or they've changed in a pretty sort of a recognizable way, then those are the clues. So it's a combination of all of those things, Naomi. It's rarely just one thing or another, but it's also a sense of, if you're the friend, to have that intuitive sense, an intuitive thing comes up in you where you just feel like something's not right with my friends, just something's not right with my family member. And that's when you've got to go with that and ask some questions.
That's so true, because so often when we may feel intuitively that something is not quite right, the other person, the friend, is in the process of pushing us away anyway.
Yes.
So, it's being intentional, as you said, about understanding that people will want to push you away, but understand that that's part of it, and we have to be intentional about,
absolutely.
Out at that time. And 2 weeks, I think that's quite, to be consistently different in so many areas of your life for over 2 weeks is a good clue that, that something is not quite.
Yes.
And